Welcome to the fifth episode of the show, Third Perspective. In the first three episodes, our guest was Dr. Azita Sayan from America, which my friend Iman interviewed. In the fourth show, it was Dr. Zamanian from California, which I interviewed by Zoom. And in the fifth show, for the first time, we have got a health professional in person, Abby Tabakoli, who is joining us today in Perth, Australia, and she's a dental hygienist. Abhijan, welcome to the show.
Thank you very much for having me.
Oh, it's our pleasure. So, Abhijan, first I wanted to, because a lot of people don't know about dental hygiene in terms of which health professionals are involved. In Iran, we only had dentists. In here, there is dentist and a dental assistant. Mm-hmm. And people are not aware that doctors, pharmacists, even there are many other health professionals who are involved with dental care. So can you please tell us a bit about the work that dental hygienists do, and is it mainly talking to patients, or is it practical work, or a combination of both?
There's definitely a combination of both. As a dental hygienist, I'm involved in a lot of preventative dentistry. These can be many procedures, most commonly the scale and clean that everyone goes for every 6 months. And it is a surprise that a lot of people don't know what a dental hygienist is. I'm sure it's becoming a bit more common now, but dentists that do the clean, I think the hygienist does a better clean, so it'll be better.
Yeah, cool. So you talked about cleaning. So with whitening, can you tell us a bit about that? Because for a lot of people, even if they don't have any dental decays, the color of the teeth is very important. So can you tell us what discolors the tooth and what are the preventative strategies? And then I will ask you about the treatment. What can you do about it? So yeah, you can tell us a bit about that.
So whitening, a lot of times it's actually just naturally teeth become yellower as we age.
All right. So it just happens naturally. It's not the result of necessarily, like some people say, coffee or this and that. It naturally happens.
That would be staining.
Yeah.
External staining can be removed with the cleaning. So coffee and tea cause staining, external staining, which can be cleaned by your dental hygienist or the dentist at a scale and clean appointment.
Sure.
So you don't need to do whitening for that, actually. You can just either, if it's light, you can brush it off and have brighter teeth.
Oh wow, yeah. And then in terms of when it comes to soft drinks, some people say soft drinks are not good, coffee is not good for the color of the teeth. Some people say apple or apple juice is good. So can you tell us a bit about that when it comes to nutrition and eating and drinking, and what helps and what doesn't help with teeth coloration or even decays?
With apple juice, the reason why it's not actually good for you if you're having too much of it. So the key is moderation, I guess.
Yeah, in everything, moderation in everything. Yes.
With apple juice, it's acidic and it has a lot of sugar in it, even if it's natural. Sugar is not good for your teeth and your body. So yeah, that's why it's not good.
All right, yeah.
But
so what about the fruit apple? If someone has an apple, there was this myth in Iran that they said before you sleep, if you have an apple, you don't even need to brush and all this.
Right.
Which are some of them can be I don't know, superstitions, or maybe it's true to some extent, because I understand it reduces the acidity of your teeth, right?
It actually increases the acidity
of
your mouth.
Okay. Yeah.
Any food that you have actually increases the acidity of your mouth initially.
Sure.
There are some foods like cheese can buffer the acidity.
Sure.
Without getting too technical.
Yeah.
I think moderation is definitely the key, and also how frequently you are having foods.
Sure.
So if you're having an apple a day, that's okay. But if you're having, an apple every couple of hours,
yes,
or snacking every couple of hours, that's definitely really not healthy for you.
Sure. That's like me and my cousin Mona in Tasmania. Actually, for those of you who have seen it on social media, we did a thing, and people are seeing the photo now. So It says an apple a day keeps the doctor away, an orange a day keeps the postman away. Generally, if you throw fruits at people, keeps them away. So don't throw too many fruits at people, or like it's not good for your teeth. Because if you throw too many fruits at people, they may punch you back in the tooth. So
Definitely not.
yeah, definitely don't fight people in nightclubs, or they can like slam you with the chair and then you can break your teeth, which happened to one of my friends actually.
Oh,
Yeah.
no.
But anyway, so Abjan, with regards to brushing the tooth, how many times a day do you recommend people to brush? At what times? And I know we all know flossing is important, but can you re-emphasize the importance of flossing for our viewers? For those people who think brushing and using like Listerine, using mouthwash is enough.
Mhm. Definitely should be brushing twice a day, morning and night.
Morning and night, right?
Yes. And in terms of flossing, you definitely have to floss once a day. You can use interdental brushes
Sure.
instead of floss if
Yeah.
you prefer. It makes it easier.
Right.
And
And they are at different sizes. I've seen in pharmacy.
there's different sizes, different brands. Anything you like, as long as it fits okay.
Sure.
It is a good idea to clean between your teeth because no matter how well you brush your teeth, there's still nasty bacteria between your teeth.
Sure. So you would get decay anyway, even if you brush twice
You
a
can
day.
get decay,
Yeah.
you can get gum disease,
Yeah.
and that's actually where I do a lot of my work.
Yeah, because people, again, some people when it comes to dental healthcare, they think it's just about teeth, whereas it's about gums, it's about the tongue, it's about inside your
whole
cheeks,
oral,
like the whole, like even your throat and all that. So yeah, Abidjan, there are too many questions, but our shows are very short. I try not to make them too long.
Sure.
Because we are not obviously on satellite, so it's just on social media, which people don't like to. I mean, because people are so busy, they normally don't watch the show when it runs for so long, and that's what I found out. Like my shows who are more than half an hour, they don't get too many viewers. But thank you so much for joining us. And
Thank
yeah,
you
is there
for
any
having
last
me.
thing you would like to say to the viewers?
Thank you for having me. Don't forget to follow